Hello, Dr. Wells. My name is Vira Muradasilova, and today I will talk about how economics influences health systems and health education. We will look at how market forces, value based programs, and financial incentives work together to improve population health. Here's the structure of my presentation. First, I will explain how market economics, supply and demand, competition, and cost effectiveness shape health systems. Then, I will show a real world example of CMS value based programs. After that, we will see how financial incentives, I don't know, can strengthen health education efforts. And finally, I will show a visual timeline of these programs and summarize the key points. Uh, okay. How market economic shape health systems. Okay, healthcare resources are limited. We only have a certain number of hospital beds, specialists, and medications. As the population ages and chronic diseases become more common, demand grows much faster than supply. This leads to waiting lists, higher prices, and difficult decisions about where to spend money. Competition between hospitals and insurers can improve quality, but it can also create gaps in care, especially in underserved areas. Cost effectiveness analysis help us decide which services give the greatest health benefit for the resources we have. Ah. A clear example of economic changing the health system is the CMS value based programs. In the past, hospitals and doctors were paid mainly for the volume of services they provided. Now, part of their payments depends on quality. There are five original programs: the end stage renal disease quality incentive program, the hospital value based purchasing, the hospital readmissions reduction program, the physician volume modifier, and the hospital acquired condition reduction program. All of them shape the same three goals: better care for individuals, better health for population, and lower costs. Now let's look at how financial incentives, excuse me, I don't know this word, work together with health education. A company called Reciprocity Health created a platform named TheraPay. They give each person a personal debit card and load small amounts of money, usually $10 or $20, every time the person completes an education module, gets the lab test, or attends an appointment. This approach works especially well with Medicaid patients who often feel overwhelmed, distrust the system, or face stigma. Health education by itself is important, but when you add a real financial reward, people are much more likely to turn knowledge into action. This timeline shows how value based programs developed in the United States. It starts in uh, 2008. Excuse me, because of German language, this is not easy for me. Sometimes I make mistakes. Okay, 2008 with the MIPPA law and continues through the Affordable Care Act, PAMA, and MACRA. You can see the gradual appearance of ESRD, QIP, hospital VBP, HRRP, the volume modifier SNF, VBP, and finally MIPS and alternative payment models. It is clear picture of how policy and economics have slowly changed the rules of healthcare financing. In many American communities served by Medicaid managed care organizations and federally qualified health centers, good programs exist. But people do not always use them. Therapy shows one way to close this gap. First, the incentives are carefully calculated so that even a 20% increase in the participation pays for itself by preventing expensive hospital stays. Second, rewards are given immediately and spread throughout the entire care journey, which builds trust and reduces fear. Third, the money is linked to educational steps, so health education becomes real behavior change. Yes, okay. Uh, Here are the main points to I want to remember. Market forces, supply and demand, competition, and cost effectiveness decide how limited resources are allocated in health systems. Value based payment models shift the financial incentive from volume to quality and outcomes. Financial incentives based on behavioral economics and significantly increase participation in health education, especially among low income groups. When economics and education work together, we achieve better individual health, better population health, and more sustainable system. Thank you for your attention.